You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, we're talking about smile makeovers. We are here with San Diego's cosmetic dentist, Dr. Kim Dankworth. Dr. Dankworth, welcome to the program.
Thank you, Randy. It's great to be here.
Now, your husband was just on the show. He's great. And, I asked you before we came on, I said, do you consider yourself a cosmetic dentist?
I do, absolutely. It's what I absolutely love to do. My patients come in every day. Everybody's got something different that they want. Maybe just a little bit of bonding, show a little more tooth, maybe some white teeth, or a whole mouth full of veneers. So
you do. Now, for people that don't know you, I guess you do, general and cosmetic dentistry.
Yes, absolutely. Family dentistry. We see young children, we see older people. Anybody that has a mouth, wants teeth, and chew, all ages.
Okay. Now, we talked. You say it can be affordable.
Yes.
To have a great smile.
Absolutely.
Are there a lot of people that don't like their smile? We've talked a little bit about
Many
this.
people don't like their smile.
Really?
Absolutely. And it can be from every reason. We can all pick ourselves apart very easily. And a smile is where we usually start because it shows who we are. Are we happy? We need our teeth. We eat. We socialize. There's many reasons why people look in the mirror and not feel as good as they possibly can about themselves.
Is it more women that are doing this in your practice than men?
No, Randy, it's actually about 50-50. There are men that will come in, and sometimes they've waited a little bit longer. They're busy, they've got appointments, and sometimes they just forget to schedule themselves. And then once it's very meaningful to them, they've got a reason to do their smile, they'll come in and then they're all in. Once they've found the place they're comfortable, they're safe, they know that they're going to get the best job they can possibly get, they're ready to go. So
okay, good.
Men as many men as women.
Okay, good. Now, these photos, are these some of your favorite patients?
These are some of my favorite patients.
Okay.
Keith came in, he's a young man, and he has a very youthful smile. You can tell that there's a space between his teeth. His teeth are a little bit flat. Randy, this man is a businessman. He doesn't look like it with this smile.
Okay.
He feels uncomfortable. He's becoming very successful. He feels like when he smiles, he's got the smile of a very, very young man. Somebody maybe in high school, still has a space between his teeth. The other thing you can see in this picture is that his smile is a bit upside down. Instead of going up in the corners, you can see this is going down. And so he feels like
curved.
It curves down. So it makes him feel like he's not approachable, that maybe when he's thinking that he's not smiling inside. So he wants to change that. The only way you can change that is with some veneers.
So when you see this, by the way, you're on the consult. What goes on in your head?
Oh, when I see him, I can instantly already see the end result. So with the system that we have in the office, I can actually do a custom wax up so that he's got resin veneers on that we can take off, but he can wear them home. He can look at them and see what he's going to look like, and then we can make the decision to make them longer, wider, whiter. And so he's got sort of a mock-up that he can play with, and look at the way he looks afterwards. He is one of my very favorite patients. He's so happy. He smiles all the time. He's got an amazing family, and we see all of them. See his wife, his kids. It's a great family.
Wow. Very nice.
Thank you. Randy, you don't have to do a lot to make the smile look a lot better, and that's pretty much what we did right here. He was so thrilled. He picked up that mirror at the end of the appointment, and he was just knocked out. He had no idea that he could look this great. He was very happy at the end of that appointment.
Now, when it seems like, and I told you, I could spot veneers walking down the street. Looks very natural.
I have heard you say that. These veneers look very natural. They were very thin. We didn't have to take down a lot of tooth structure. It's not invasive. So that made him very happy. He didn't want to have his teeth cut down. So putting on veneers that were very thin, very lifelike, absolutely beautiful artistry went into these veneers, and they'll last for a very, very long time. Randy, look at this next patient.
Okay.
She has spent years taking care of her family. She has broken down smile, a very aged, old smile. And wait until you see what she looks like. This is a beautiful professional woman, and her smile does not reflect at all who she is. And so when she came to me, she has every tooth is a different color. There's decay. She wanted every tooth the same color. She wants healthy gums. She wants to be able to smile and not have her hand in front of her mouth. Absolutely beautiful
you said
young
you
woman.
see the end result. Do you get excited, kind of?
I get very excited when people come in and they want me to show them how I can change the way they look. It's magical. I already know what they're going to look like. So when she said, yes, let's do this, I already knew she's going to be a knockout, an absolute knockout.
Okay.
Look at this picture. These veneers are exquisite. They're beautiful.
Very
They're
nice.
white. When she smiles, it looks like her natural teeth. She does not have to have, she doesn't have to be embarrassed anymore. She can smile however she wants. She doesn't have any tooth pain anymore. A lot of what she was going through right there was fear. She knew that she had waited a long time, and she was really thinking that there was not an answer, not a good answer. She was really afraid that she was going to lose teeth, and that wasn't the case at all.
So people put it off and put it off.
And the anxiety
Is there usually
builds
like a
and it
tipping
builds.
point? Something, an event
Something happens. Maybe it's an anniversary, a wedding, someone's graduating. It could be anything. We never know what it is, but people come in with those kind of reasons all the time. There's something that says, do it and do it now. Sometimes it's just the fear of having more pain or having something else go wrong. And most people know that if you wait too long, you've got a lot more dentistry to do. You sit in the chair longer, things will take longer. So she didn't wait too long. It ended up being a great situation.
Okay, good. Now you have a stack of photos, and for the sake of time, what else?
Stack of photos. One of the things, Randy, look at this young man. He's a very professional man. He has very stained dark teeth, and he's had them for a long, long time. He told me that he has wanted to do this for as long as he can remember. What I can see with him, Randy, is that he's already got a very full, broad smile. His teeth fill in those corridors on either side so that when he smiles, he's got everything going on for him. He's already got the foundation.
So the teeth go from one side to like a broad smile.
Really broad smile. That's what people want braces for, is to fill in where we smile, where that cheek to cheek. And he's got that. He wants nothing more than to just change the color. And when you don't have a lot of decay, it pushes off the decision to do something. So just to change the color, he never felt like that was a good enough reason to put veneers on. And when he finally did it, it was the most fantastic result ever. Look at the smile on this man. Look at his eyes. He just lights up. He's
Very nice.
Thrilled. He just could not be happier.
So how much say-so do they have in the process? Like what their teeth are going to look like?
They have a lot of say. He actually is very much an engineer type person. He wants to make decisions. He asked me if he could help me decide on what color and shape they were going to be. So in his custom temporaries, he took them home. He took my shade guide home. We've got 4, 5, 6 different colors of white, and he played with them for a week to figure out what was going to make him happy. He was going to choose that color, and so he got his custom temporaries. We played with the length of the eye teeth. We played with everything. He really wanted to be a part of making these decisions, and so it was fun for him. And at the end, he got exactly what he wanted. He's got a beautiful smile. He's very happy. Here's a new picture. This is a patient, and she's had many previous dentists. Every dentist decided to make her tooth a different color.
That just ended up happening. I guess they didn't
it just
decide
ends up
this.
happening.
Okay.
No, you go from one person to another. They don't look to see what color do we want. How do we? And this is many patients. Many patients do that. You find a dentist, something didn't work out. You're going to find somebody else. She's got something going on with every tooth, and she cannot wait to have every tooth look exactly the same. She asked me over and over and over again, please, the only thing I want is that when I smile, I want all of these teeth to look like they were all done at the same time.
Looks old. Is that an older woman?
she is not an older woman. Wait till you see the after picture. She is absolutely beautiful. And her smile doesn't do her justice at all. She, again, her teeth, her arch is already fills in those areas on the sides of her cheeks. She's got great landscape to work with. And just giving her those beautiful new crowns that
Let's
she
take a
wanted.
look. Wow, what
Look
a
at this woman.
difference. It does make a big difference.
Look how young she is.
Yeah.
Yeah. Yeah, her other smile, those teeth,
Now
those
for
crowns.
her though, I mean, this is pretty much. I mean, it adds to her attractiveness, but
It added to
'Cause this is a
who
big
she
deal,
was.
yeah.
Every time she woke up in the morning and you're brushing your hair, you brush your teeth, you look at yourself, you think, gosh, why do my teeth look like this? Why can't I just take time to go and do this for me? And when she finally made that decision, one of her friends had already come to see us, and she said, fix every tooth. Please, just make them look like they all belong together.
okay,
It was
That's very
wonderful.
Nice.
Yeah.
Very nice.
She's very happy, very happy. This next person is a young man. He became quite famous overnight. He's an author and a speaker nationwide, and he has a very youthful smile. One of the things you can see in this is his two teeth in the front have a space, but then when you go to the side, he's missing a tooth. And so there's no symmetry there. And he very much notices that.
Looks like it's upside down a bit too.
His smile, again, goes a bit upside down. And he wants to be able to have a cover shoot for the new book that he's doing. And so he didn't give us very much time. He knew he wanted veneers. He knew he wanted them to be spectacular. And he was going on the road. So they had to be quick, fast, and look great. And so when we worked with him, this is what he ended up looking like.
Wow, very nice.
That's Jose.
Let's see these look.
Yeah.
You know, people need to know these. I mean, these are real interviews. I'm not trying to side with you,
No.
but this is really nice, natural
Very nice,
work.
very
Because I
natural.
always think of veneers as being big.
You know what? A lot of
And they
people
can
think
be.
that. They yes, those are one of the questions people say. Am I going to have to learn to smile over again? Will my lip get stuck on my teeth? And the answer is absolutely no. We use an artist, and we have used him for about 20 years.
The person that makes the teeth.
The person that makes the teeth, absolutely, master craftsman. These veneers have shape in them. There's anatomy. Your lips should run over them, and your tongue should run over them. You should never be able to feel that it's any different than your natural tooth.
Now, you say you fix other people's work sometimes.
I do, Randy. Sometimes people will come in and they'll have had an extremely bad experience in another office, and I fix other dentists' work.
Okay.
This is one of those times. She came in and she was so sad and so scared. She had no idea that anything could get this bad. Her
Now, why
teeth
is this
didn't look
bad? I
this-
mean, as a professional, what is bad about this?
Oh, the porcelain is flat. It sticks out. They just did the front 6 teeth, and she needs to fill in the corridors all the way back.
Yeah, those teeth don't look real.
No, it looks like she bought something at the drugstore and just snapped them on. It's absolutely not cosmetic dentistry at all. She ended up with us.
This is what you did.
This is with us, master craftsman, beautiful porcelain. She is a knockout.
Wow.
Yeah.
So look at the.
And that's what she went in thinking she was going to get. So she's
So the difference in the teeth you put on is what? I mean, because these have ridges.
they have
Yeah,
ridges.
I guess they look like regular teeth.
They look like regular teeth, but there's so much that goes on behind the scenes. You have to do your homework. You've got to know, where's the lip line? How do they hold their mouth? Do they have a little pull to one side? Is there a cant anywhere? There's a lot of experience that goes into being able to call yourself a cosmetic dentist. When you put veneers and porcelain crowns on your patients, you want to make sure that when that smile is out in the community and they say, this is my dentist, that's something I want to be proud of. I don't want to live someplace else and do dentistry in a different city. I want my patients to see me in the grocery store. I want to be able to hang out with them, and I want them to be proud to say that I'm their dentist.
Do you ever? I mean, you've been here for what, over 16 years in San Diego doing dentistry. Do you ever get people that approach you and say, "Hey, you did my teeth," and
Oh,
They're
people
still-
come up and say, "Oh, they're beautiful. They work." I have I have dentists in other states that'll call and say, can you send us some records from so-and-so patient from 10 years ago? I'll say, yeah, I can't believe it. I kind of lost track of them. Where were they? And he'll say, by the way, that was the most amazing dentistry ever. Her veneers or his veneers look as good today as they did probably the day you put them on.
Somebody watching this, they don't like their smile. Maybe they're worried about finances or whatever. What do you say to them? But they hate their smile.
I say there's no time like the present. Do it now. Make the decision. It's affordable. It'll change your life. It'll absolutely be the best thing that you've done for yourself in a long time.
I want to thank you for coming to the show.
Thank you, Randy.
Pleasure.
Yeah.
Thanks. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website at wellnesshour.com. Put in Dr. Dankworth. For now, I wish you good health.